Women's health is women's history. March is Women's History Month, and this year's theme is Providing Healing, Promoting Hope. As the professional community for women's health nurse practitioners and other providers who care for women, this is what our members do every day. NPWH celebrates our history and the trailblazing women who provide healing and promote hope in their communities and for our profession.
Our history begins in 1980 when a group of 20 nurse practitioners from Planned Parenthood affiliates across the country came together to form the National Association of Nurse Practitioners in Family Planning. Their mission was to assure accessible, quality family planning services and reproductive health care, and to advocate for nurse practitioners in women's health care. Throughout the next decade, our mission and our membership grew. In 1988, we changed our name to the National Association of Nurse Practitioners in Reproductive Health, and in 1989, we established our headquarters in Washington, D.C.
In the 90s and into the 2000s, NPWH worked to expand access to care and the NP scope. We fought for nurse practitioners to be able to insert and remove subdermal contraceptives. We improved education, creating the first standards of practice for the education of WHNPs and certifying over 50 programs and self-study offerings. We advocated for important policies that affect our practice today, like Medicare reimbursement for nurse practitioners. We also officially changed our name to the National Association of Nurse Practitioners in Women's Health.
The 2010s were a decade of innovation for our organization. We launched the Women's Sexual Health course for nurse practitioners with our partner, the International Society for the Study of Women's Sexual Health, the only continuing education on women's sexual health for advanced practice providers. We released our Well Woman app, putting knowledge, guidelines, and screenings at practitioners' fingertips. We held our Healthy at Any Age meeting, which turned into our bolder Women's Health Coalition. And we became involved in the Women's Preventative Services Initiative, an effort to review and recommend updates to the guidelines that keep women healthy. NPWH is the only nursing organization on the WIPC advisory panel, and we're proud to represent that perspective.
Even though we're only a couple years in, the 2020s have been some of the most challenging in our history. For our profession and for our members, we are proud to support our members with education, updates, and advocacy through the COVID-19 pandemic. And we are in awe of the resilience and strength of our profession. This decade also brought some important self-reflection and change. In 2021, we created our Inclusion, Diversity, and Equity Statement. We hold it to the same level of importance of our mission and value statements, and it guides the work we continue to do as we work towards a more just, healthy, and equitable world.
In 2021, we also launched Nurses Improving the Environmental Health of Women and Children, a collaborative effort between nursing organizations to promote women's, children's, and maternal health by reducing the environmental factors that contribute to health disparities and harm. This work becomes more and more pressing every year, and we are dedicated to finding actionable solutions to environmental health challenges.
Our history is still being written. Every day, WHNPs are providing healing and promoting hope in the lives of women, whether that's on the national stage, in laboratories and libraries, at policy-making tables, or in exam rooms. Thank you for being a part of our history.